Hey guys, one of the most important factors for healing your diastasis is getting your ribs moving out to the side. Remember, we just don't want front pressure on that diastasis. And a lot of women have very fixed rib cages. So one of the things that works for getting this loose is a little bit of myofascial release. I want you to think about this as foam rolling for your abs, except we're going to do it with our fingers because we don't want to be foam rolling too much on the side of our rib cage. All right, are you ready for some fun? Because this is going to hurt. Oh, so good. All right, I want you to give me your belly. All right, so let's see it. Pull up your shirt. I'm going to have you, we're going to go up and down, and then we're going to go side and side. So external obliques, internal obliques, and we're going to do your rectus. All right, and we're going to loosen, we're going to foam roll with our fingers your fascia to help send signals to your brain that says, all right, you can loosen a little bit. And remember, loose is good because it means expansion, which then means full contraction. So remember, we've got to get your ribs moving, which means your oblique muscles also have to move. All right, so if those obliques are just nailed down super tight and never moving, that's going to constantly pull at that diastasis. All right, so let's start from the middle, and this shouldn't hurt unless you have some fascial adhesions. So grab and roll. That's it. You're just, think about this as you're just, what you would do, the foam roller, we're just putting a little bit of pressure on the skin and the fascia. Get all the way up into that front of that rib cage. All right, so my rib cage is here. I am starting above it. And yes, I'm a little sick, but if I never film sick, I have two little germ factories, so I seem to always be fighting something with them, coming home and rubbing snot in my mouth. All right, so up and down the front. So that should be loose and pain-free. And yes, we all have some fat. 6 months postpartum. I still have some fat, okay? So roll, 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 get it all loose. It should feel great. This should not be painful. If it's painful, you know you have some tightness, just like if you were gonna get on the foam roller. So I kind of equate this to waxing when I do it on patients. It's like, all right, this is going to hurt like hell, but then as soon as you're done, it's gonna stop hurting. There's no lingering side effects of pain. All right, now let's get those obliques. So start way up here, and then you're gonna roll down towards your belly button, okay? And these are those external obliques down into that belly button. Good job, and back up. Very good, all the way up into that rib cage. We wanna get those ribs loose. Okay, other side, so grab out here, and if you're even having trouble grabbing skin, remember the fascia is that shiny layer when you pull the skin off chicken, raw chicken, that shiny layer that is between the skin and the meat and fat, that is fascia. It has tons of nerve endings. It likes to help direct the body as to what to do. And if it's tight, your body's gonna know it. All right, good, get all the way up into those ribs. Good job. Now, internal obliques. So start on the inside and work your way to the outside. So middle of the rib cage all the way down to that front pocket. I want you to see if you can get over that iliac crest, so your hip bone right here might be a little bit tight, but you can do it. And then back up diagonally up into that rib cage. Ooh, that's a little bit tight. I can tell my internal obliques are pinched tight because that direction is a pinch painful. All right, other side, up here and go. All the way down. Isn't this fun? Yay! You didn't know you were going to be torturing yourself so much today, did you? Good, and all the way back up. Great job. All right, rub it out. Oh, all right, now what you should feel, go ahead and put your hand on your rib cage and give me a nice big inhale. It should feel a little easier to move. And if you're an abdominal gripper, ooh, this is going to be super painful because your fascia has been like grip, 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 constantly sending signals from your brain telling you to grip down. All right, so fight through it. I want you to work on this a little bit, maybe every other day, every 3 days. a little bit every day if you want to. It's okay, until it's not painful. So if you can do it and you're like, I don't even feel anything, it's just like rolling the skin on the back of your hand. So if you don't believe me that this isn't painful, grab the skin on the back of your hand and roll it. Okay, it doesn't hurt at all because there's no dysfunctional muscle going on the back of your hand. Okay, and so think about this as if there's pain, there's most likely movement dysfunction that's causing that. So I want you to roll until it is no longer painful. Now if it's super painful, then just be very gentle. You don't even have to like roll. You can just kind of pick up and move back and forth and pick up and move back and forth. Okay, so if rolling is too painful, then try that technique until you can roll it. All right, because what we're going for, we're foam rolling our skin, except we're doing it with our fingers. All right, so get those obliques and let me know how that turns out.